Imagine a nation where your fundamental rights include free healthcare. Today, I want to convince you to advocate for free healthcare. I want to inspire you to urge the government for contempt and free healthcare to improve the well being of everyday citizens in the US, including you and me. Instead of being an amenity enjoyed by a certain few individuals, every American should have the fundamental access to medical care. Free healthcare provides Free healthcare provides that everyone gets a timely and essential medical care without having to worry about the cost, regardless of their financial situation. It promotes an environment that people believe their well-being and health comes before financial gain. The United States upholds as one of the nations that pays the most on healthcare. Healthcare in the United States is expensive. The cost of medical bills, hospital bills, and doctor's visits are through the roof, and Americans cannot keep paying for medical expenses when they're ill. Everyone should have the access to free healthcare because they should be able to live healthy lives from the stress of excessive medical bills. Preventative measures. Everyone can receive the attention they need when they are ill and need preventative measures when healthcare is available to all, regarding of their financial situation. Free healthcare encourages the development of an equal society in which no one is left behind because of financial strain. It ensures that individuals can promotely treat health concerns without having it to be a more serious concern in the future. In the article, 5 Reasons Why Medical Coverage Should Be Free, the author states that every $1 invested in healthcare can produce $9 to $20 in full income growth by 2035. Money that families have spent on health is money that can be spent on sending a child to school, starting a business, or coping with an emergency. Also states that universal health care can help stop the world's biggest killers, the poorest and most marginalized populations, like marital deaths, diseases like HIV, tuberculosis, and non-communicable diseases. The Ebola crisis clearly demonstrates the urge to need and strengthen healthcare systems everywhere. This article was written in 2014, but the Ebola crisis similarly falls under COVID-19. It was kind of an unexpected disease to the world, so it abruptly affected all of us. After COVID-19, the healthcare system worsened. COVID-19 had a significant effect on healthcare. A lot of healthcare professions put in a lot of overtime, which led to increased stress and fatigue. The attention on COVID-19 cases frequently resulted in the delay or disruption of routine medical procedures. The epidemic also brought attention to the in disparities in access to the healthcare that already existed. Individuals had trouble receiving care in a timely manner, and vulnerable communities suffered more than others. The COVID-19 pandemic highlighted the significance of having effects an easily accessible healthcare system that can adjust to unexpected challenges. For example, in 2021, deaths rose to more than 400,000 Americans dying. It had been shown that if the US provided universal health care, more than half of those lives would have been saved. And around $450 million would have been also saved. Research shown by the Yale School of Public Health states that the researchers compared people without health insurance, examining death rates from COVID 19 and overall. Building on earlier researches, they calculated that 1,438 COVID deaths in 2019 could have been avoided with universal single payer health care. On the other hand, the potential effects on the economy since the creation of a full healthcare system could have required significant public funding. Concerns have been expressed as well as about the possibilities of higher taxes needed to pay for universal healthcare. Some people may prefer the private healthcare system that is in place now and concern switching to a government style system will reduce options and the competition. Political differences and differences in culture also are important. Some Americans place higher value on personal responsibility and independence more than they do on more centered around groups to approach healthcare. The National Library of Medicine states in the article Universal Healthcare in the United States of America, a healthy debate. That tax rates would rise exponentially because of universal healthcare. The cost of universal healthcare would depend on its structures, benefit levels, and extent of long coverage. However, most proposals would entail for increased federal taxes, at least for higher earners. One proposal for universal healthcare recently pushed and include options such as 7.5% payroll taxes plus a 4% income taxes on all Americans. The healthcare system may be strained if free healthcare is provided during a situation such as COVID-19 because of its high demand for services. There may be challenges financially in providing free healthcare during a crisis because of the unexpected spikes in medical costs that could put pressure on the government's funding, and maintaining the impact of large health emergencies can establish a cautious balance with offering necessary health care. One example given by the article, How Much Could COVID-19 Vaccinations Cost in the U.S. After Commercialization? They provided a sentence that states, the federal government has spent more than $30 billion on COVID vaccines, including the new bivalent boosters. Enticing their development guarantees a market and ensures that these vaccinations will be provided free of charge to the U.S. population. So these vaccines costed the United States citizens an exponential amount of money coming from their pockets, their taxpayer monies, and it significantly impacted the economy. Lastly, it is essential that we all get together and fight for everyone's basic access to healthcare. Our combined voices that our combined voices has the power to create an effective change and build a society in which having access to free healthcare is a fundamental human right and not a luxury. You should take action by educating others, voicing your opinion, using social media as a platform, joining campaigns, and staying persistent. Every American should have the right to excellent health care. And rather than it being just an aspiration, we should all work towards universal health care, recognizing that each and every one of us has the ability to completely transform our healthcare system when we unite and demand for change.